sharp, knifing pain, contractions, kidney stone, soreness.
That's how Stacy Falk described her pain after a tummy tuck 13 years ago. And it's not because she has a low pain tolerance.
Tummy tucks, breast implants, breast reductions and lifts, liposuction. Those are the cosmetic procedures that hurt the most.
Now compare that to Tara Khan's experience with her tummy tuck just 6 weeks ago.
It didn't hurt. I felt just very tight. Like maybe I went to the gym and did too many sit-ups. That was it.
What made the dramatic difference in pain relief? A relatively new local anesthetic called Exparel.
It's a very slow time-release formulation, and people get the injection before they wake up, and they have no pain whatsoever for days after the surgery.
The surgery itself is done exactly the same, but at the end, Dr. Gerut injects the Exparel anesthetic into the whole surgical field. The secret to its long action is that a conventional local anesthetic is encapsulated in a series of tiny fat globules that act as a sort of time-release device, maintaining pain control for days, after which plain ibuprofen or acetaminophen is usually enough, avoiding opioids. Downside, it works too well.
Since they're pain-free from day one, they may move around too much and actually do some harm to the surgery, so you have to be careful.
I like to walk. I started walking 2 weeks later, and now I feel absolutely, fantastic.
Now, there is one other downside, and that's cost. It adds about $500 to the surgery, but when you're spending thousands on a procedure, it's not that much extra, and you avoid opioid painkillers with all their possible side effects and addiction risk, of course. Exparel is also being used after joint replacement, oral surgery, spine and obesity surgery. Almost anywhere post-op pain relief is needed. And, I don't want to say that it's perfect, you'll never have any pain after surgery, but it makes a big difference.
So it doesn't have the same addictive sort of tendencies?
No, it's not an opioid at all. No, it's a local anesthetic. It's just kind of a time-release local anesthetic, so you get that time-release effect, that pain relief effect over days at a time. And once you get past that acute phase, those first 72 hours, 3, 4, 5 days, then you don't need a whole heck of a lot other than maybe ibuprofen or, Tylenol.
Wow. Might be worth the $500.
Absolutely.
Could be a big deal.
Thank you, Dr. Mack.